Hello everyone, I am Dr. Bari, working as a diabetologist and family medicine specialist in diabetic hospital. Today I am going to discuss about thyroid tumor, that is understanding about thyroid swelling. First of all, we all need to know what is tumor. A tumor is a swelling anywhere in the body. It may be benign or malignant. Benign tumor usually localized, slowly growing and don't spread. And malignant tumor rapidly growing and spread through lymphatic channels to the lymph nodes and through blood to the other parts like lung, kidney, liver and bones. Now, thyroid swelling or thyroid tumor. It is swelling within the thyroid gland, and thyroid swelling or thyroid tumor is common and mostly benign and rarely malignant. Thyroid gland is a butterfly-shaped gland situated in front of the neck just below the Adam's apple. It produces thyroxine and triiodothyronine, which plays an important role in metabolism, temperature regulations, pulse and heart rate, mood and excitability, and digestion. Thyroid tumor or swelling may be solitary or multiple. It may be cystic or solid. Presenting features or symptoms of thyroid tumor: swelling of thyroid gland which moves with deglutition, difficulty in swallowing, hoarseness of voice. Sometimes thyroid tumor or swelling can be identified incidentally when neck is examined for different purpose. Diagnosis or test: thyroid tumor or swelling can be clinically identified by standing behind the patient and palpation of the neck to identify the size, shape, number and involvement of the local lymph nodes. A good ultrasonography can indicate thyroid swelling or thyroid tumor. Fine needle aspiration cytology: under all aseptic precaution, a needle is introduced into the thyroid swelling or tumor and moving it to and fro to collect aspirated cells and placed under microscope for study to determine whether it is benign or malignant. Biopsy. Biopsy is definitive of diagnostic of thyroid tumor or swelling. Types of thyroid cancer: papillary thyroid cancer. It contributes about 80% of the thyroid cancer. Tendency to grow and spread within the gland and surrounding lymph nodes. After surgery, patient can lead normal life. Follicular carcinoma of the thyroid gland. It contributes about 15% of the total thyroid cancer. Has tendency to invade the capsule. It is angio-invasive and by invading the blood vessels, it can spread to the other parts of the body. Medullary carcinoma of the thyroid gland. It contributes about 2% of the total thyroid cancer. It secretes hormone and carries manifestation of hormone secretion. It usually have a familial predisposition. Anaplastic thyroid carcinoma. It is very much aggressive and virulent type of cancer. It spreads rapidly and grows rapidly through the blood vessels to the other parts of the body, and it is very difficult to treat. Almost all thyroid cancers are slowly growing except anaplastic thyroid carcinoma, which is very much rapidly growing. Treatment of thyroid tumor or thyroid swelling. Surgery is the first line of treatment for thyroid swelling or thyroid tumor. Surgeon can excise major part of the thyroid gland But before surgery or preoperatively, if it is confirmed that the tumor is benign and it is confined to right or left lobe of the thyroid gland, it can be operated as right or left hemithyroidectomy and sent for biopsy. If biopsy defines that the tumor is benign, no further treatment is required. And if the biopsy determines that the tumor is malignant, then radioactive iodine therapy and further adjuvant therapy is needed to treat the malignant tumor. During surgery, if surgeon identifies that there is involvement of multiple local lymph node, it can be resected by block dissection. Peripricking is the term when only enlarged lymph node is removed. It happens in papillary carcinoma of the thyroid gland. After removal of the enlarged lymph node, patient can lead a normal life. If biopsy determines that the tumor is angioinvasive, there is chance of spread of the cancer through the blood to the other parts of the body. In such case, after removal of the thyroid gland, we can do a thyroid scan or bone scan to identify is there any other area where the radioactive iodine is taken up by the residual cancer cells. If there is any other area is identified as taken up of radioactive iodine 131, a follow-up radiotherapy is given to the patient and radioactive iodine will destroy the residual cancer cells. When there is a virulent anaplastic type of cancer is identified, external beam radiotherapy is given to the patient followed by a radioactive iodine therapy. In some cases, other than radioactive iodine therapy, chemotherapy is needed to kill the residual cancer cells. We should keep in mind, after removal of the thyroid gland, there is reduced production of the thyroxine and triiodothyronine, which in turn stimulate the pituitary gland to secrete more TSH, and the TSH will lead the rapid growth of the residual cancer cells, as cancer cells are TSH dependent. To prevent this, we need to replace thyroxine orally. That is all about my presentation regarding symptoms, diagnosis, types of thyroid cancer and treatment of thyroid tumor. If you find that the presentation is helpful for dealing patient with thyroid tumor in future, you can like, comment or subscribe my channel. Thank you all.